Welcome to A Shot in the Arm podcast. I'm your host, Ben Plumley, and this is the podcast about innovation, equity, and global health. In this episode, we are going to recap and review everything that happened at the 78th World Health Assembly that's just concluding, with my co-hostess with the mostess, Yvette Raphael. But before we get into it, just a reminder that we can't do this without your support. If you haven't already, please subscribe to our show wherever you get your audio podcasts. And we're really trying to build up our audience on YouTube, so please visit our YouTube channel at www.youtube.com/@shotarmpodcast. Like this episode, subscribe, hit the notification button to be updated when we release new video episodes. So, back to the fallout from the World Health Assembly, and here we are with American Academy for the Advancement of Science's Breakthrough Awardee 2025, and my partner in crime, Yvette Raphael. Yvette, how are you doing?
Hi, Ben. How are you? I'm great. I'm exhausted from all the traveling, but I'm okay. I'm great to be back home.
Well, you were in Geneva for the World Health Assembly, but you'd done a bit of a European trip. What were you up to? Where were you going, and what were you doing?
Yes, Ben, imagine me spending about two weeks in Europe. It was a first, and quite getting to know the differences in the countries. I went to Spain initially to attend the World Obesity Congress, which is something that we've always had a passion about as APA, as an organization, just making that connection between HIV and obesity and the drugs that we take.
Now, before we get into World Health Assembly then, and in fact this is quite relevant given everything that was going on there, the relationship between HIV and weight is one of the most underreported stories, and I know it's something that has really bothered you. Tell us a bit more about it, because as well as obesity, it's about slim, it's about weight loss as well.
Yes, and it's also about NCDs, Ben. And as you know, people living with HIV are affected by NCDs, other NCDs, and they are underreported and nobody really talks about it. But when it comes to weight, I speak to young people a lot, and they are excited to take up any treatment, any HIV prevention method, treatment, as long as it doesn't play into the issues that they have, like their weight. So a lot of us don't talk about just when you take ARVs that you actually do gain some weight. And as you say, you lose some weight. And the big thing, the African bum, we don't want to lose that.
The African bum, not invented by Kim Kardashian, but from the mother continent.
Yes, from the motherland and the continent, especially that it's important that we talk about really why people don't take up treatment, don't take up HIV prevention, because they don't want that to affect their bodies. So it's important that we talk about it and we actually find solutions for people living with HIV, and also start talking about what can we do better.
Well, brilliant that you were there, and I hope we can come back to it in future episodes. I know, our fellow co-host Eric Gooseby is very interested and committed to understanding and promoting more about NCDs, non-communicable diseases, for people with a long history of HIV. So, should we talk about Geneva? And
Yay.
First up, I got to ask you, that interview that didn't take place at the World Health Assembly, but was spread around the World Health Assembly like fire. And it was from the Qatar World Economic Forum, I think, and this really brilliant Bloomberg journalist, Michal Hussein, who had an interesting interaction with your favorite South African. And your favorite South African, Elon Musk, besides interrupting her and trying to belittle her, said, okay, so what programs in HIV are not being funded? Let me know and I'll fix it right now. And we then had a press release from UNAIDS sort of calling him out on that. So what did you make of that all? It certainly seemed to be something that captured a lot of people's attention in Geneva.
Yes, Ben, I think, first of all, just the denialism around it. I thought we'd have denialism around other things, but just denying that you are responsible for bringing down one of the biggest programs that help Africa in development, and also just to hear that the lack of understanding of the impact of what that have. One of the things it had on Africa and on the world at large. But one of the things that was so painful for me, and I'm so passionate about this, is almost like show me the orphans. That is so painful, and it shows that Elon Musk doesn't understand the history of HIV. He thinks this is some kind of publicity stunt. It is not. These are real people and real people's lives, and the lives that he actually impacted by closing down USAID. And we're vetting there with PEPFAR too. So it was just not good to see. And I kind of understand where UNAIDS come from, and I know everybody's going to wonder why, but also just hoping that he will change his mind and reinstate or fix the nonsense, for a lack of a better word, fix all the damages done globally. People are out of work and you're making a joke to say, show me an orphan or show me the orphans. It's heartbreaking. But UNAIDS, on their part, have to do the diplomatic stuff and, say, let's hope you're going to fix this, or also say they're holding him onto his word when he says he'll fix it. I don't trust that guy. I don't trust what he can do next, but yeah, let's see. Hopefully diplomacy works, eh?
Well, I thought it was not a bad press release from UNAIDS, because it did what press releases are supposed to do. It caught people's attention. I mean, there's no way in hell Elon Musk will listen to UNAIDS, and there's no way in hell he is going to revisit the cuts in HIV funding, because, of course, Mr. Trump's big, beautiful bill for tax cuts has to go through, and there is not going to be any space for increased funding, even though it's a little tiny, tiny bit of the trillions that are going to be made available in tax cuts. But I thought it was perhaps a bit of a error of judgment to begin with, because there was clearly no way that Musk was serious about promising to see a problem and then fixing it. But I did rather like the way there was something almost sort of slightly cheeky, not multilateral bureaucracy about the release. And so I thought that was quite interesting.
Yes, and hoping that we can hold him accountable to that and get to understand how his mind works, if it does.
Yeah, well, I've had enough of your favorite South African. Let's talk about the World Health Assembly itself, and particularly from an HIV lens, first of all. So after the Obesity Summit in Spain, what did you do in Geneva? What were you up to?
Ben, I was part of two panels, one with regards to just talking about food and children and obesity and NCDs. And then I was part of the South African government and UNITAID session where they spoke about the pandemic treaty and what that means for the world. And it was exciting just to be part of those discussions, but also during the World Health Assembly, everybody's everywhere. It's such a big festival, I would call it, because you can never catch anybody that's there. You can never have a bilateral meeting outside of what you went there for. You can never catch anyone. So it was actually one of those things that was a first for me to experience, but it is really, really an important space to be in. But there's a lot for us to reflect on, and I think most importantly it's what are your thoughts about what was happening? I know you watched from afar and participated in some of the online work, but please tell us, what were your thoughts, especially around the budgets?
Oh, trust you to throw it right back at me. And there I was trying to get your thoughts. Well, look, let's come to the budget in a minute, but let's talk about this pandemic treaty. And, you are right. I didn't go this year. I was completely reliant on you, and thank you for that. it was really interesting to watch what was going on without having to shuttle between venues across Geneva. But the pandemic treaty, which was really profiled as one of the main achievements of the World Health Assembly, and it's been 3 years in negotiation. And Tedros, Director General of the World Health Organization, and all the member states there hailed it as a major achievement. But you know, Yvette, 3 years in the making, the only reason they were able, in my view, to get to an agreement before this World Health Assembly was because the United States wasn't there. It had pulled out of the negotiations itself. It's obviously indicated that it's leaving the WHO when its year's commitment is finished, which I guess will be at the end of this year. Hopefully there might be some rethinking. But the pandemics treaty was supposed to be something that all countries could sign up to ensure that the vaccine inequity and vaccine populism of COVID never happened again. Mm-hmm. And not wanting to be too pessimistic about it, the two key things that really mattered, how to share information about new pathogens, how to then share equitably access to medications, vaccines that are developed rapidly to combat this new set of pathogens, whatever they may be. Those two things have been shunted to further negotiations. The two things the member states couldn't agree on have been shunted. And there's also a sort of a chapeau, a hold-all, that WHO would be responsible for managing the sharing of information about the pathogens and coordinating the distribution of the vaccine or the treatment that came out to deal with that pathogen. And it's just not clear to me that the WHO, love it to pieces, but has the capacity or the mandate to be able to do that. So that phrase, like the curate's egg, good in parts, I don't know, maybe that's even an exaggeration. What was your sense, given that you were sitting there with Unitaid and others?
No, important, Ben. And when I went up to speak, one of the things that I noted is the two female leaders. And I said in my opening remarks that if you want action, you bring in women, the two co-chairs who are women. You bring in a little bit of South Africa and you add a little bit of HIV advocacy in there by bringing in Unitaid, who's been a leader in this. So I see it much different, and I am much more hopeful that this time around we will see some movement with the backing of WHO. It's also important to know that some of these names hold global importance and people understand the role that they have to play. And I think we can push it as advocates. We can push for it to really not be just a beautiful paper. And like I said, I got some hope when I saw the two women, the two co-chairs, South Africa, and I think it's France, if I'm not mistaken, who are leading this. So it's very, very, very important that we support them and we give them all the tools and we give them all the backing that they need. But this cannot be another beautiful document that we've signed, like some of the declarations that we do all the time, and they all only pile dust in some cupboard. But I am hopeful.
Well, that's good. And it's always good to have your optimism to counter my pessimism, as always.
Yes, but they say budget. Yeah, let's go to the budget. But it's also important to know that you have some of the background that I don't have, because you work much longer in the space and in those bureaucracy.
Yeah. Well,
and the budget now, Ben.
Yeah, my years of working at UNAIDS gives me plenty of experience and hardened realism about how to navigate bureaucracy. But the budget. So obviously, coming into this World Health Assembly, the WHO has a major budget shortfall. And Dr. Tedros has implemented a really significant program of cuts right across the board. All of the regional offices have a cut of 14%. Whether it was wise to cut it equally across all regions is perhaps questionable, because Africa then gets the same rate of cut as Europe does. Does that make sense? And then, of course, you've got the cuts in staffing. And obviously, one of the big criticisms of Tedros's leadership since, I guess, just before the pandemic is that he's increased the number of really senior director and assistant secretary general posts at the UN, at the headquarters, the Geneva level at WHO, which is hugely expensive. And so the really significant cuts to those directors was announced just prior to the World Health Assembly. What I think was disappointing from an infectious disease perspective is that the Assistant Secretary General for Infectious Disease, the Frenchman Prof. Salomon, was one of the folks that got let go. He, in a beautiful posting on LinkedIn, expressed full support for Tedros, which just goes to show the sort of level of political, diplomatic leadership that this guy has. We have Dr. Chikwe from Berlin, who headed up the WHO pandemic hub there, and he's moving back to replace Mike Ryan, the Irishman who was really the face of the WHO's response to COVID, and we will really miss Mike. There's no question about that. And then we have the Brit, Farah, who was at the Wellcome Trust in the UK, who is now playing an increasingly important role as, I think, a senior advisor right across the board to Tedros. So it's a really interesting evolution. But what it means for whether WHO can continue to fulfill the mandate it already has, let alone any other, I think is up in the air. Now, the WHO announced that all the member states, bar the United States, of course, committed to increasing their contributions by, 20%? And that's brilliant news, but there's still a major funding shortfall to come. And it raises a really interesting question, Yvette, that I think is something you and I have noodled with and feel quite strongly about. And that is the balance of leadership between global North and global South in these multilateral institutions. And you said you were there with the South Africans. How do you feel that the member states across the continent were feeling about how would I describe this? How assertive they could be in trying to push the agenda rather than sort of tinker on the edges as beneficiaries of northern donor largesse?
Yeah, and that was on clear display at WHO. This time around, African leaders with their delegations were expected to play a much bigger role than just the group with trying to find funding for their countries, but really also commit to the global South doing much more for its population. So there are countries who are expected to up some of their commitments for funding and also to just expand and close the gap domestically. That is the call that I heard a lot out there, is that there's an expectation for the African countries to really look into their own pockets domestically, because it's just not fair to us as the people from those countries to know that somebody else is responsible for taking care of our health. We appreciate most of the donations. We appreciate all the work that has been done by the funders, but it's important that we take responsibility. You cannot fight your neighbor for not looking after your baby because you went clubbing.
Yeah. It also brings us back to the reality that with these cuts to USAID and cuts to PEPFAR and the State Department, that there is no going back. And
yes,
that Western activists, frankly, who feel that the pressure should be placed on forcing the US to reverse these cuts. I think that's a fool's game increasingly. I'm sensing from talking to African health leaders that this is yet another example, the final example, that the time of relying on donor funding for health priorities is well and truly over. And so, as well as needing to manage health budgets from domestic resources, countries need to recreate, rebalance their relationship with institutions like the World Health Organization. And you could see that very clearly with South Africa. How did that come across to you while you were in Geneva?
Yes, Ben, and as I was also moving through those corridors, those many meetings, one of the things that I clearly picked up and could sense is that as much as we appreciated the donations and the funding and everything that is done for us, importantly is that we see this now as what we expected to have happened during this period is a transition period into our countries taking action. So importantly, as you know, and I'm going to focus on HIV, although I know that World Health Assembly has much more happening than just HIV, is that we are now at a space where we have to focus and also transition ourselves. We would greatly appreciate if some of the funding comes back, some new funders stand up, which we would like to see. But this is the last 5 years till 2030. If we can think that after 2030, we can still be doing the same old things, we are also fooling ourselves. So the next few years for us is to not actually reinvent ourselves, but come up with new strategies to ensure we reach that goal that we set for ourselves, that 2030 should be the year that we end AIDS and have made greater strides for HIV. So with prevention being such a low, it is a low-hanging fruit, but nobody's really interested. Everybody's fighting for keeping HIV, people living with HIV alive, and which I totally understand. But without HIV prevention, we will not get to where we would want to be. So it's important that this next 5 years be transition. We ensure that our governments do understand the importance of HIV prevention as much as they understand the importance of HIV treatment for people living with HIV, because we need a future free of HIV for our children. And I know I say that a lot.
Well, you do, and you're quite right. And so 2 reflections on that. First is that I think you're doing yourself and the countries of Africa, perhaps, or many countries in Africa, a not disservice, but you're under reflecting the expertise and the innovation that's already come from the region. And I always use the example of the emergence of community health workers as an innovation that was forced and forged out of necessity because there weren't enough doctors. And it's a model that is being applied elsewhere in the world. You see it in the UK with this sort of strange physician assistant class coming through, but you particularly see it, for example, out here in California with organizations, say like one that I'm associated with, the San Francisco Community Health Center, which is all about community taking care of itself. The other thing that I think is perhaps where I would take issue with you a little bit is around, I mean, we're dealing with this international commitment to end AIDS as a public health threat by 2030. And there's a whole separate conversation there. But it does speak to the plethora, the sort of scattergun of commitments that came out this week at the World Health Assembly. And let me read through some of them. A declaration on non-communicable diseases, a call for a tobacco-free generation, digital health, rare diseases, elimination of cervical cancer, guinea worm disease elimination, skin diseases, and here's a nice one, Indonesia moving from Southeast Asia to Western Pacific as part of the regional makeup of the World Health Organization, World Health Assembly. Do you feel that we are tinkering with the edges and not dealing with the big, big, fundamental structural issues about how health in this world is organized and managed, moving from doing what little we can to get away with for those who are most in need, to one of genuine solidarity. And I feel that we're just not grasping it fully.
I think you're right in a sense, Ben, that we are so used to doing the same thing over and over again that we don't want to see the changes. We don't want to really make those commitments. And like I say, these next 5 years should be of commitment and holding each other accountable to ensure that those things do happen. I don't think we should grapple around some of these commitments that are just airy-fairy, like you say. And I know people who work hard on these won't agree, but sometimes we need to prioritize and just choose what we need to do. And for me in HIV, it is HIV prevention.
Yeah, it's a bigger issue, isn't it? That
yes,
right across health, it's not about bringing everything and the kitchen sink. It's about prioritizing the things that really matter. And I don't mean, having rattled off that list, that I'm in any way opposed to guinea worm disease eradication or the elimination of cervical cancer. Far from it. But I think the overriding architecture is something that is so important we cannot put off talking about. And from the California perspective, from far away, I didn't see any of that happening. Perhaps it was in the Intercontinental Hotel just up the road from the Palais des Nations in Geneva. Maybe it was happening in some of the corridors and the cafes. But that really has to happen. And it brings me to one of the, can you call this a highlight or a negative highlight of the World Health Assembly? And that was the video presentation, the video speech from the US Secretary of Health and Human Services, RFK Jr., who gave a predictably tone-deaf presentation to the delegate hall. And there was just one thing that he said: the WHO really isn't fit for purpose, and that the US is interested in working with countries in another mechanism, perhaps on a sort of a coalition of the willing basis, to identify ways that could really prioritize collaboration on the health matters of real concern to the world. And, well, I don't think it's wrong to describe the way his speech went down as like a fart in church. But what was your sense of the reaction?
Ben, I must say that after a week ago, him saying that nobody should trust him for any scientific advice, I don't think I have a comment there. I mean, what can we say? It is really, really sad that we have comments like those and we have to take advice from people who don't even trust their own scientific expertise. So let us leave that one there.
Well, moving on then quite rapidly. What did you make of China's presence at the World Health Assembly? They came with the largest delegation they've ever done. And from word that I heard on the ground, they were everywhere.
No, as expected, Ben. I mean, China has been showing everybody that they can really show up, and they have been showing up, and it is in those spaces where you make impact. And unfortunately, the US have lost that space, and we need to give China an ear. I think we downplay also the role of Europe on how much they give. And we need to start really thanking the guys who are saying we can step up. And I think China is taking that role very seriously. And many people, many countries, delegations were having their ear and listening to what China has to offer. Also China having to hear what people want from them and what we expect from them. So it's going to be a very, very interesting future, but it's important that we need to understand that countries need to commit to global health. And one of the things about global health is it has to be decolonized. And it as you can see, it's really one colonizer to another.
Well, that is the risk, isn't it? And that's always been the big criticism of China, coming in with deals that perhaps don't impose the human rights related requirements that Western donors have traditionally done, but have very tough commercial arrangements on countries.
But I must say, in South Africa, China is a BEE partner. You know, it is recognized. So it's going to be interesting going forward, Ben. And I know South Africa and China have a good relationship. So we need to watch that. As you mentioned, some of the, just the human rights issue. And for us in South Africa, important are our labor laws. How much you pay people, how much time they get off. And China is not very famous for that.
No, but I think, again, it's like the curate's egg, good in parts. I think there is real value to China's engagement here and stepping up, whether it's cynical and there is seeing an opportunity to exploit the United States' withdrawal from the territory, but it's still in everyone's interest. You mentioned the Europeans, and at the moment, Germany looks like it's the biggest contributor, depending on how you count the money, to the WHO. And there was something quite hilarious that happened. The German delegate speaking at the one of the sessions, and I forget which role this German played, but he did something that has never been done in a World Health Assembly before, and that is that he tried to sing a Spice Girls song. He opened his remarks by saying, "I'll tell you what I want, what I really, really want." He was sort of badly singing from the Spice Girls' first song, Wannabe. And what he really wanted was an effective multilateral system that expressed global solidarity. I mean, more power to your elbow, I absolutely agree. But it is interesting that the sleeping giant that is Europe isn't playing a more coordinated, bigger role. Deathly silence from you there as you take in the significance of performing the Spice Girls at the World Health Assembly.
Yes, but I think everybody at the WHO was, trying to show their muscle. And I think Germany, as you say, we just don't recognize them enough for their contribution. And I think they were there to also just show that their muscle and what they really do. And I think more opportunities for us to engage.
So coming out of the meeting, and of course, as we record this on Sunday, the 25th of May, technically there are still a couple of days left of the World Health Assembly. But what's your top line reaction? Do you think the WHO and the World Health Assembly that acts almost as it does act as the governance mechanism for the World Health Organization, is it fit for purpose? Does it need major reinvention? Or do we just need to show up, stand up, and commit to the things and act on the things that we have always believed in passionately?
Ben, I think the WHO has a very difficult role trying to coordinate global health for all the countries. And one of the things that I do want to say it's really important that we reevaluate and rethink, because the cuts has happened. WHO will have to cut 50% of its staff. So it's how we prioritize. I want to say prioritize more than ever. Is that what are the things that we are going to use to make a difference with the little time and money that we have? We do not have the luxury of resources anymore. So we need to really see some successes coming out and some leadership. I know WHO has, this diplomatic role into engaging countries, but we need to see real things coming out, especially around some of the safety issues, some of the things that we really don't want to touch on. But I think it's important that WHO really plays the big brother that it's supposed to be.
It makes me think of a comment that the former Minister of Health of Senegal, and she was also, I think, head of the malaria program at WHO, Professor Awa Kolsek, she said that if you really want to take health seriously, you got to take it away from the ministries of health and make it, a financial and a presidential priority. And I think I've always thought there's a lot in that, but I really think we have to start taking that seriously now.
Yes, and countries have to prioritize health. And like South Africa, I would want to come back to South Africa and talk about the budget increase that we've seen since, the cuts in January. We had a budget speech and our budget was adjusted. Importantly, it will impact on a national and provincial level. Still lots of shortages at the district level, but we have to see the Department of Health taking health seriously, to implement and to not take money back to Treasury. One of the things that countries also have a problem with is that ministries not spending their budgets and every year returning money to Treasury while programs have not been implemented, while hospitals are dilapidated, while the healthcare systems are collapsing. So those are the things that should not happen if we do take health seriously across the continent and globally as well. I'm sure some of the issues are what affects other countries as well. So we cannot have ministers of health who don't know how to minister health.
That's a really good one. Now, it wouldn't be a podcast coming at the end of the World Health Assembly week if I didn't ask you about a meeting that happened with your president, not in Geneva or South Africa, but in Washington, D.C. And I'm sure you will be relieved to know that President Cyril Ramaphosa made it clear that he would not prioritize purchasing an aeroplane for Donald Trump over domestic priorities in South Africa. How did you feel that, whatever it was, that ambush was like for the president and for the people of South Africa?
I think, Ben, you would be surprised. I was extremely proud of President Ramaphosa. And so you can fix your glasses, everything, not for the very first time, but I knew President Ramaphosa, he exhibits and he has that flair, he has that diplomacy. He would not disappoint his country. And going into that presentation, what was meant to be an ambush, I think it was a well-organized. What we had there was a show of South Africa, bringing the golfers in, bringing the rich guys in, bringing young people. There was a matriculant there. Cyril Ramaphosa and his team really, really worked hard to ensure they show who we are. We are a beautiful country of Ubuntu. And I felt so proud of my president because he did not stoop low to that level. I could not imagine what it meant to be American at that time of that interview. I know there were big mistakes that were made. I didn't expect Johan Rupert to save the day for South Africa. He really, really went out and he loves this country. We might not agree on many things. Like he is the boss of white monopoly capital. And, people do not like him because he owns so much money. He's the richest guy, one of the richest guys in South Africa, if not the richest. I don't count people's money, so I don't care. But he really is passionate about South Africa. What was also important is that just before my president, I said my president. My president went to the US. He really, really visited the farmers, the real farmers. By the way, what America got was no farmers. Those are chances. Those are people looking for opportunities. And that is where we are. I am very, very proud of my president. I'm proud of the team that he went with there. They really did across the board after the White House. I saw them taking interviews. I saw them visiting. I saw them talking to people on the street in the US. And that is what Ubuntu is about. And for once, was I proud of my president.
Oh, well, something we can agree on. Pride in Cyril. As you know, that is something that you and I disagree on from time to time. But
a lot of times.
Lovely. So anything that we've missed, anything else that stood out to you that you think our viewers and listeners should be aware of?
No, I think importantly, and I would bring this here, it's because some of the advocates were arrested during a week ago, protesting at some of the interventions in Congress. I think it's important that we take a moment and just recognize HIV activists in America, in South Africa. Our own veterans came out of retirement to fight for us. For me, that is everything. That shows that we are fighting for the right things. And just to know that it is not just happening in the US, they have that tight solidarity that reminds me of, the olden days when the Americans would bring us ARVs this way, Zaki Ahmad receiving them. And that is where we are at. And it's an important moment. I want us to spare just a moment and think about those wonderful advocates. To see Charles King in those rooms fighting as hard as he does, to see Zaki and many women from Khayelitsha and Guguletu, old women coming out of retirement and shouting and screaming, that shows pride, and that shows just how strong the HIV movement is. And they were there. Some of them were also there in the corridors, getting lost in Geneva, trying to run to meetings in the rain. So a big up to our advocates.
Oh, yeah, absolutely. South African, Pan-African and American, and those that are making their voices heard in hearings inside Congress, including our Asia Russell, who has been thrown out quite a few times in the last couple of months. So
he was arrested and was detained for a few days. That broke my heart. But yes, God bless her. And I know she does this with passion. So big ups to everyone.
Yeah. Now, for me, the biggest announcement happened just before, and it was by the Global Fund. And it was of an agreement that happened between a Kenyan pharmaceutical manufacturer and the country of Mozambique for this Kenyan pharmaceutical company to supply HIV medications to Mozambique in what is essentially, I guess, one of the first major African to Africa collaborations that have been navigated through the Global Fund. I pick my words carefully because, of course, South Africa's Aspen Pharma has been a long-time provider of medications right across the continent. But this was, I think, materially different because it was a domestic Kenyan manufacturer that had passed all the quality control and pre-qualification mechanisms of the WHO to provide that start of a sustainable supply of medications. But what was interesting to me is that the press release from the Global Fund did not mention the pharmaceutical company concerned. It was all about the Global Fund, all about the Ministry of Health in Mozambique. So I'd like to wrap up by giving a big shout out to the Universal Corporation Limited of Kenya, who are the manufacturer of dolutegravir, lamivudine and tenofovir, TLD, that is now being provided to Mozambique. So, viva Universal Corporation.
I see, I rub on you, Ben. Very soon you are right on the path of saying Amandla.
I'm very close to it, trust me.
Yes.
Well, look, Yvette, I know we've reached our time, and I just want to say thank you for everything. I'm glad you got home safe and sound in South Africa. It's been quite a day, I believe, already for you with your pet's giving you some grief and mayhem and in need of maternal care, I think.
Yeah, no, definitely. And it's so heartwarming to be back home and just to be back with my babies and my furry babies. As you know, I love them a lot.
Well, thanks again so much for being on this episode, Yvette, and look forward to seeing you and catching up with you again very shortly.
Thank you, Ben, and have a great morning while I go to bed.
Well, that's it for this episode. Thanks to Yvette. Thanks also to Waisha Raphael, our assistant producer. And of course, thanks to Erica Spera, our director and producer of A Shot in the Arm Media. And finally, a big thanks to you. We can't do this without your support. If you haven't already, please subscribe to our show wherever you get your audio podcasts. And we really are trying to build up our audience on YouTube. So please visit our YouTube channel at www.youtube.com/@shotarmpodcast, and it's that sort of strange ampersand at. Like this episode, subscribe, and smash that notification button to be notified when new episodes are out. Thanks again for all your support. Have a great week and a safe week, everyone.